Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Tonight we've got the new cholesterol guidelines for you. And summertime's just around the corner, and does sunburn lead to skin cancer? We've got a dermatologist here. Also, do you take medications? We've got some pharmacy information for you. All that and the Refuge Clinic is here. But to start us off is Dr. Tessa Mullins, who is a dermatologist with the Lexington Clinic. Welcome.
Thank you for having me.
Well, you know, I think May is apparently melanoma month or something like that. I guess it's because it's summertime and sun affects the skin. Do we worry about that?
Absolutely, yeah. So the ice is finally melted and we're all getting outside more. So what a better time to talk about it than now. Yeah, so with sun protection and sunscreen, we're getting outside more. Kids are in sports more. You're at the beach. You're obviously just outside more during the summertime. And it's definitely something that I feel like is super important, but something that we kind of either forget or put on the back burner because you're just busy trying to get out the door in the summertime. But something that's so important, skin cancer just in general is the #1 most diagnosed cancer in the entire United States out of all of them. And about 1 in 5 people will have a skin cancer before they turn age 70. So that's a pretty big statistic. So definitely something that I feel like always good and a good idea just to get it on the forefront of your mind and not something to kind of put on the back burner and wait until it's too late.
Well, are there certain people at risk? I mentioned sun, but are there other risk factors for melanoma
Absolutely.
or other skin cancers?
Yeah, absolutely. So I feel like I'm seeing more and more like younger patients in my practice being diagnosed with melanoma, with all the different types of skin cancers, especially with melanoma. I feel like you have to talk about the indoor tanning risks that we still have. It is decreasing, we've seen in the past few years, but still I think there's upwards of almost like 7 or 8 million patients and people in the United States that are still using indoor tanning beds. And just one use of an indoor tanning bed almost doubles your risk of melanoma in your lifetime, which is pretty big jump.
Yeah.
So definitely something to be mindful of. I also feel like culturally, we're kind of in this tan is better and everyone looks better tan, so it's hard to beat culture that way. But a tan is actually your body's response to tell you that it's been damaged over time. So definitely something to be mindful of. And there's lots of good alternatives for spray tans and the lotions and different things that you can use. So if you can avoid the tanning bed, that is always the best option.
Are certain skin types more prone?
Definitely, yeah. So redhead, if you're naturally a little bit more pale, you do have less melanin in your skin. But honestly, everyone carries a risk of skin cancer, no matter what your skin type is like. Even if you have a darker skin type, it may take you more exposure to get to that skin cancer, but you're still at risk. So really, no matter your skin type, you still need to be protecting yourself with sunscreen and sun protection.
Family history have anything to do with it, or
Somewhat, yeah, it definitely can. And I feel like a lot of the family history, yes, some skin cancers can have a genetic component, but I feel like too, if you just grow up, you grew up with the habits of your family. I personally came from a family where my parents were like, okay, go out and get your base burn, go out and get your base tan before you go to the beach, and that is absolutely not a thing at all in any aspect. But still, if your family is out a lot and you're just used to getting sunburnt, that also plays a role.
So what's the ABCs of melanoma?
Yeah, absolutely. So it's a good algorithm to look for, as far as people come in, okay, what do I need to look for on my skin? So the ABCDs is a really good algorithm to look at. A is for asymmetry, B is for border, so anything that's not like a perfect circle. C is super important, so anything that has changing colors, different colors in it, we worry about. D is for diameter. They say anything greater than a pencil eraser, but really it has to kind of have those other changes as well. The biggest one in my mind is E for evolution. So anything changing in size, color, it's starting to bleed, become tender, definitely something that you want to get looked at.
Okay, briefly here, you mentioned, and we talked a little bit about sun and sunscreen. Mm-hmm. What's the importance of sunscreen, and do we use 8, 10, 12, 1,000?
Yeah, there's so many different options. So SPF 30 or greater is typically what I mostly recommend. 15 is pretty good as well, but if you can get to 30, you're a little bit better off. At SPF 30, you're blocking about 97% of the rays that cause skin cancer, so it's a good baseline. As you increase to 50 and 100, you are getting a little bit more protection, but 97 is pretty good. So if you can get to 30, that's at least where you want to be.
How about kids? Sunscreen safe for kids?
It is, yeah, it is. There's a lot of, misinformation and things like that out there. Babies, you want to be a little bit more cautious with. Usually 6 months and up is where I say definitely put some stuff on them. But if you're concerned about the more chemical sunscreens, what we call the physical blockers are the best place to go. It's what I put on my own children. They're the ones that are usually labeled as like mineral based or sensitive skin. They have zinc or titanium oxide in them. They're what, like I said, called physical blockers. So they just kind of sit on that top layer of the skin. Nothing's really absorbed in your skin. So if you're concerned about that at all with your kids, it's the best place to go.
That's great information. We appreciate you coming in, and thanks for all the work you do.
Yeah, absolutely. Thank you for having me.
All right. We'll be right back.